Namaskar. We begin by looking at the stark reality facing millions in our region. For families in Chandrapur and surrounding districts, cancer isn't just a diagnosis, it's a massive logistical and financial burden.
Transforming cancer care. The Chandrapur Initiative.
Bridging the gap in oncology services for Vidarbha region. High incidence. Vidarbha, and specifically the area around Chandrapur, sees a high incidence of cancer. Crucially, the current lack of local facilities means patients often waste valuable weeks or even months traveling hundreds of kilometers to larger cities like Nagpur, Mumbai, or Hyderabad. This travel isn't just inconvenient, it's life-threatening. It leads to delays in treatment, forces families into debt for travel and accommodation, and often results in patients presenting at a much later, more difficult-to-treat stage of the disease. Diagnosis mix. The gap in cancer care here is not just an inconvenience, it's a public health crisis that must be addressed locally. The current ratio of late-stage versus early-stage diagnosis is poor, emphasizing the need for screening and early detection. The good news is that a comprehensive, sustainable solution is underway through a robust public-private partnership. This is not just a government project. It's a model backed by the state and powered by the best in oncology. The government of Maharashtra has committed the land and significant capital, recognizing the regional need. Tata Trusts. Crucially, the operational expertise comes from Tata Trusts. This partnership ensures the new center isn't just a building, it will operate under the highest international clinical protocols, bringing world-class cancer management to Chandrapur. The model being established is the L2 or secondary level cancer care center. This means it will handle 80 to 90% of all required cancer treatment locally, while seamlessly linking to the Apex centers for any ultra-specialized procedures. It keeps care close to home. Let's look at the infrastructure taking shape on the GMCH campus. This will be the physical heart of the new care network. Capacity. The facility is planned for 140 beds, designed specifically for oncology patients. This includes specialized HDU and ICU beds necessary for complex post-operative care and intense chemotherapy protocols. Radiotherapy, crucial detail. The presence of 2 linear accelerators, LINACs, is a game changer. Currently, patients must travel solely for this crucial treatment. Having 2 ensures not only availability, but also minimizes downtime, guaranteeing continuous service for radiation-dependent treatments. Integrated services. Beyond the physical structure, we are integrating all 3 pillars of cancer care: surgical oncology, medical oncology, chemotherapy, and radiation oncology. This means patients receive coordinated, multidisciplinary care under one roof. While the major hospital is under construction, care has not stopped. Immediate, essential services are already deployed. Daycare. The operational daycare chemotherapy center at GMCH is a critical stopgap. Patients who need IV chemotherapy can receive treatment locally and return home the same day, saving hundreds of thousands of rupees in potential travel and accommodation costs. Swastha Chandrapur. Perhaps the most impactful current initiative is the Swastha Chandrapur screening kiosk. We know that early detection saves lives. The goal? This kiosk offers free screening for the most common cancers, oral, breast, and cervical, right here. The ultimate goal of this screening push is to flip the current diagnosis ratio. We want to catch cancers early, aiming for 70% of cases being detected in the early stages. The Chandrapur project is not simply about building a treatment center. To truly transform cancer outcomes, we must adopt a holistic approach that covers the entire spectrum, from prevention to palliative care. Prevention and awareness. The most effective way to fight cancer is to prevent it. We are committed to robust community outreach and awareness campaigns, specifically targeting high-risk behaviors like tobacco use and promoting essential screening. This is where the biggest long-term change happens. Early detection. We touched upon this earlier, but I want to re-emphasize the importance of the NCD screening program. By making early detection widely available through the Swasthya Chandrapur kiosks, we intercept the disease when it is most curable, drastically improving survival rates and reducing the need for costly, intensive treatment later on. High-quality care doesn't end when curative treatment stops. Integrating palliative and supportive care ensures that all patients, regardless of their stage, have the best possible quality of life, managing pain and offering emotional support to both the patient and their family. Workforce development. Finally, sustainability requires local talent. A beautiful building is useless without qualified hands. Through the partnership with institutions like Tata Memorial Hospital, we are actively training local doctors, nurses, and technicians. This investment in the regional workforce ensures that Chandrapur can sustain this level of excellence for decades to come. By focusing on these 4 pillars, prevention, early detection, palliative care, and training, we are building a system that is not only curative, but also compassionate and sustainable. To summarize, Chandrapur is not just building a hospital, it is establishing a complete, self-sustaining ecosystem for oncology. This partnership between the government and Tata Trusts is delivering high-quality, ethical, and affordable care that is long overdue for the millions in this region. Care is finally coming closer to home. This project is about restoring dignity, reducing financial stress, and crucially, improving survival rates. Source: Gemini and https://aistudio.google.com. Please visit my YouTube channel, http://www.youtube.com/@FromAnilKulkarni.